Hi, hello students. We are here with sagittal section of the head and neck. Let's see the various structures in detail. This is our brain. Except this we can see in detail. This is the phenoidal air sinus. A beautiful representation. There are 4 air sinuses in our body. The use of the air sinus is to reduce the weight of the skull. In front of the phenoidal sinus, there are 3 shelf-like projections called concha. These are nasal concha. There are 3 nasal concha. Singularly it is concha and plurally it is conchae. Okay, concha. It has 3 folds: superior concha, inferior concha and middle concha. All these 3 collectively known as nasal concha. And the space between the superior concha and inferior concha, this is the superior meatus where the artery forceps is there, and in between the middle and inferior concha there is middle meatus or inferior meatus. Okay, anteriorly these are hair follicles in the vestibule of the nose, and this is the atrium. And posteriorly behind the inferior meatus, this is the auditory tube. Here is appearing, and the artery forceps, this portion is tubal elevation. From this tubal elevation, a fold is going down, giving rise to salpingopharyngeal fold. This is the salpingopharyngeal fold. Another fold is salpingopalatine fold, exactly at the side of the soft palate. This is the soft palate. This is the soft palate and this is the hard palate, exactly this position. And this is the uvula of the soft palate. This is the uvula where there is soft palate. And this is the bulk of the tongue, substance of the tongue. It gives an appearance of exactly the book-shaped feature. This is the bulk of the tongue. Behind that is the root of the tongue. This area is known as nasopharynx, where the tubal elevation is there. Behind that blind space known as pharyngeal recess. This is the pharyngeal recess, where the exact position of the artery. This is the bulk of the tongue. From this area, this is known as oropharynx inside, and exactly the level of the soft palate there is perseverance bridge. This is the circular partition of the palatopharyngeal muscle, which will act as a sphincter. What is the use of palatopharyngeal muscle? It will act as a sphincter. Below the oropharynx, this is the laryngopharynx. Pharynx is divided into 3 parts: nasopharynx, oropharynx and laryngopharynx. This is the laryngopharynx. And this exact structure is the epiglottis. This is the epiglottis. This is valvula and this is the median glossoepiglottic fold. This is the median glossoepiglottic fold. And this is the laterally glossoepiglottic fold. laterally glossoepiglottic fold. Okay, and this is the root of the tongue. And this is the starting of the inlet of the larynx. This laryngopharynx continue with the esophagus. Larynx continue with the esophagus. This is the cervical vertebral column, and this is the phoenoidal air sinus. From the base it is atlas, arch of atlas, and continue with the cervical vertebral column. And this is the sagittal section of the head and neck in detail. It's very useful in anatomical viva. Thank you for watching.